Hi, I'm Christine Kessler. I'm coming to you from Orlando at the MEDS conference. I suggest to you that the gut is the biggest player when it comes to chronic disease. The stunning rise in obesity and autoimmune disease over the past 70 years has forced us to look at the gut in terms of its effects on immunologic function and neurologic function, its incretin hormones, and the microbiome. Now, the microbiome has captured the nation's attention. We know that the microbiome contains trillions of bacteria that live within us and on us in numbers that are 3 to 10-fold our tissue cells. And they live in a very complex interdependence. And when their ratios of diversity is off, we get sick or there's dysbiosis. And what happens with dysbiosis? Cancer, psychological illness, obesity, autoimmune disease, IBS, and increased pain. So what is causing this dysbiosis of the microbiome? For answers, we're actually looking in early childhood to the biggest causes for the autoimmune diseases that I've just talked about. And the biggest thing that we're looking at is the use of C-sections, bottle feeding of the child. Early antibiotic use is a huge impact on the microbiome, and also the sterile environment that came to fruition in the 1950s and continued for our children. So what can we do? Judicious use of antibiotics. Hopefully vaginal birth, if at all possible, and we're looking at ways to populate the baby's microbiome with the mother's own perianal microbiome. And then and we're also looking at breastfeeding whenever possible, and we're also suggesting you get a dog. And what about the use of pre- and probiotics? Prebiotics helps potentiate a healthier environment for the microbiome. And how do we do that? Eat fiber, bananas, apples, asparagus, and other things. As far as probiotics, that is introducing bacteria that is healthy to the microbiome. How to do it with food? Well, kombucha, fermented foods, as in kefir, and one of my favorites, red wine. To hear more, come to MEDS.